This is live IDEAS Bulletin number 7 with Charlotte Mbu and myself. I'm Rida Sadki from the Geneva Learning Foundation. We just finished one live chat, which was an electronic immunization registries. If you missed it, it's okay. You can view the recording. And in just over 1 minute, we will be speaking with Dr. Mohamed Sorwer Alam, and he will be sharing with us how he is planning catch-up immunization activity through training, tracing, and vaccinating missed children during the COVID-19 pandemic. Hope you will be able to join us, and very much looking forward to hearing from Dr. Mohamed Sorwer Alam. See you soon. We're creating the COVID-19 Scholar. A warm welcome. A little technical glitch to start off this live IDEAS Bulletin number 7 with Charlotte Mbu and myself. I'm Rida Sadki from the Geneva Learning Foundation. We showed you a graphic where we were landing on the African continent, but we're actually going to travel to Bangladesh right now with our guest that Charlotte Mbu is going to introduce. We're going to be speaking about, really hearing firsthand testimony about catch-up immunization during the pandemic. Charlotte?
Yeah, thank you, Reda, and good afternoon to you. I want to say warm welcome to our guest today, Dr. Mohamed Sorwer Alam, that's joining us from Bangladesh, exactly from Chattogram in Bangladesh. And we want to thank you first and foremost for accepting our invitation. And I'm not going to go into details on his activities, but just to say that he's one of the 800 scholars that went through the exercise one of the COVID-19 peer hub, and he got to develop a project and an action plan, and he's here today to tell us about his peer hub experience and what he's doing on the field to face the challenges in immunization that are posed by COVID-19. So you're welcome, Dr. Sorwer Alam. Over to you, Reda.
All right. Welcome, Doctor. Please introduce yourself and tell us where you're connecting from, and perhaps what you were doing right before you joined this call to share your experience during the pandemic.
Hi, good evening from Bangladesh. So I'm connecting from Chittagong, the port city of Bangladesh. And thanks to both Reda and Charlotte for inviting me here. I have been working as surveillance immunization medical officer under WHO in Bangladesh. So my job responsibility includes providing technical support to the government health authority regarding immunization activity and surveillance activity, vaccine preventable disease surveillance. So it's my fourth straight course in Geneva Learning Foundation. Actually, I took 3 previously, so I'm an alumni to this great learning platform. Of course, I like the modules generated here every time. So thanks again for inviting me here.
Thank you. Could you tell us a little bit about Chongaon, where you work. I'm showing pictures on screen. I trust that you recognize some of these locations.
Yeah, so this is actually the office location where we actually sit the WHO local office in Chittagong. But I work in Chittagong City Corporation. That is one of the biggest urban area in Bangladesh, and also the port city in Bangladesh. So I actually cover like 6 million people. And huge migration problem also here. So yeah. That's what I've been doing.
Great, thank you. All right, Charlotte, over to you. Let's learn about catch-up immunization activity. What exactly has Dr. Mohamed Sower Alam been doing to keep vaccination going during the pandemic?
Yes, Reda, and I'll go right away by first of all asking Dr. Soalam to tell us about the COVID situation in his district. What is happening? What happened? And that's what happened that it led you to this moment when you're talking about catch-up immunization of children that have missed their vaccination.
Yes, thank you, Charlotte. So overall, in Bangladesh, the COVID situation has been improving in I would say last 1 month. But before that, whole of the Bangladesh was affected, and Chittagong, especially the Chittagong City Corporation, was second most hit areas where COVID cases were so much. And currently, I think more than 2,000. The attack rate is more than 2,000 per million population. Also, doubling time around 17 days. Every 17 days, the case is being doubled. So yes, 70% of total Chittagong district cases happening in the urban areas rather than in the rural areas. And currently, I think 17,000 positive lab confirmed cases for COVID-19 here only in Chittagong City Corporation. So this is a big number, I would say, but situation improving. But in April and May, the 2 months where country-wise lockdown were imposed, and like many other district and city corporations, Chittagong City Corporation was badly affected, and we already working in very challenging situation with all those migration issues, with the high dropout rates of the children. So it actually worsens the situation. Almost 2 months, the session dropout was more than 50%, and the coverage was pretty low. Even those 50% session happening, they had very few coverage. People not showing up for vaccination. So it was 32% of MR second dose missing children, and at least one dose, or I would say one antigen children didn't receive one antigen. It is like 13% or 14% exactly. So huge number of children actually missed immunization in these 2 months. That's why it came up to my mind whenever I was actually going through the ideas engine. It was a great platform. I like the platform. So many ideas, and many of them are relevant to my working challenges. So I pick up the issue because we do not want to be like below 80% coverage at the end of the year, and it will cause huge pressure, especially the PPD outbreaks all over the urban areas. So we needed to cover up these children by the end of 2020 to avert those vaccine preventable disease outbreaks. So that's why I choose this catch-up immunization activity or project for this peer hub.
Thank you, Dr. Soa. And talking about the IDEAS engine, how do you contribute an idea to the IDEAS engine? If yes, how many?
Yeah, I actually, this is the second one. I contributed with one before that. So this is the second one. Rather than contributing, I actually like to read those ideas. It is so vast, like 1,000 ideas. So I went through each and every one. Some were very good, some were not relevant to my context, but I like the ideas. Yep.
Wow. And just for the benefit of those who are watching us who are not part of the hub, just to say the IDEAS engine is a platform in which over 3,900 immunization professionals came together in the period of 2 weeks and were able to come up with over 1,200 ideas. And Dr. Sowa is telling us that he went through over 1,000 of those ideas. So at some point, we may be turning towards you to consult you on what were the main themes, the main ideas that that you found captivating. But for now, I would like to ask you another question that's in line with the project that you drew up, and based on using the ideas, some of the ideas that you got from the IDEAS engine. So how did you set out to address the issue of missing children drop out due to the condition that was exacerbated by the COVID-19 pandemic?
So I already mentioned a couple of issues actually raised up. First of all, demand for vaccination was reduced, very badly reduced. People were not showing up. Caregivers were not taking their children to the facilities which are open. Then there was country was lockdown situation. So people not, vaccinators, they are not running session regularly. Some fixed sessions were open. I think around 47% sessions were dropped that moment, that 2 months, and most of them were outreach, and some of them were also fixed session. Also, there is issue.
So what
Yeah.
I really want to say, what are the actions? What have you started doing to change the situation, to make a difference? And what do you intend to do in the coming months so that the situation gets back to normal, and in terms of your immunization coverages?
Yes. So first of all, nationwide, from WHO country office, we developed a 2-hour hands-on training module on infection prevention control. So our realization was that our vaccinators, they are not confident enough to run the EPA sessions because of their safety issue. Also, they lacked personal protective equipment. So countrywide, from July and August, we actually trained so many health workers. I think 27,000 in whole country, and for Chidong City Corporation it is like 120. So I took hands-on training of 120 health workers on infection prevention control, and how do we run immunization session, maintaining all the safety precautions measures during this COVID situation. This is one of the things that actually improved the situation by boosting the confidence of the health workers as well as the caregivers. Now caregivers know that they are using PPEs properly. They are looking after them so that nobody gets infected. This is one of the issues. Second thing is demand generation activity. So from national level, again, they had this from national media, and also through the live bulletin they used to give countrywide. They actually acknowledge the issue that countrywide there is a huge drop in immunization coverage. So we also, from our local level, we try to sensitize through the local media and local their health divisions social media pages that people should show up now, because now they are maintaining all these safety precautions and they are ready to vaccinate their children, so that they can show up. Also, there is issue like those facility based immunization was greatly reduced because many facilities turned to be or converted to be dedicated COVID hospitals. So people fear that if they go to these facilities for vaccination, they might get COVID-19. So we again acknowledge the issue, and we use IC materials in front of those facilities to let the guardians know that it is absolutely safe to come here and vaccinate the children because they are now properly trained, they are using proper PPE. So it is good to, and also if they don't give the children vaccination on time, they might face in coming months, like in winter, they might have some measles outbreak. There is already spreading measles cases problem in Chittagong City Corporation. So these are the kind of activities we planned. Also, there is contact tracers. City had 200 contact tracers for COVID-19. We use them because they are going house to house. So we use them to inform the parents that if there is any unvaccinated child who is due for vaccination, they should show up in the vaccination center. And our final strategy was to run all the stations that was dropping, especially the non-government officials. They have been supporting with 35% sessions in Chittagong City Corporation, the non-government partners, and because of financial crisis during this COVID situation, they stopped their immunization activity. So we tried to sensitize, we tried to support them to again get back to the immunization program, or our city corporation staff, they actually got those places and started immunization activity. And finally, those catch-up sessions, like especially immunization activities in the weekends and holidays, even we are planning for evening sessions. So these extra sessions actually works people started to come back in great number. We do not want all of them to go to a station and overcrowd this station because it is not good for physical distancing. So they might in different session, like in the weekend or Friday session or holiday session, more in a physical distanced way, so that nobody gets infected.
So we have our first
Okay.
question from Amel El Tahir, who asks, how was the dropout compared between the period before and after reduction of COVID-19? And I believe we actually have the table. Let me see if I can fit
Yes.
the entire table in, if I may.
Yes, Reda, I just can tell you the update. After we started the activity as well as COVID started to drop, there is 4% reduction in the missed children for MR2. It was 33%. Like now in recent update in August, it is now 29%. And if we go like this for next 5 months, 4 months, like 5% or 6%, I hope our target is to reduce the drop missed children number below 10%. We can achieve that.
Okay,
All
thank
right.
you.
Yeah, I just wanted to ask one question. So I wanted to find out, why did you target MR2? You know, to be like the antigen that you want to improve upon the dropout rate.
Yes, very good question. Thank you. So I already mentioned Shillong City Corporation having a high dropout rates, especially those antigen given later period, like 9 months MR1 and 15 months MR2. Also, sometimes 23. So what happened? These are urban areas. So during the lockdown period, many people left for their urban city home to village home, and they, because of financial crisis, they never actually came back or planning to come back in a different area of the city. So I just wanted to set up a definite goal. If I took BCG, it won't be it will mislead actually. Like many people coming here for facility delivery, then they deliver giving BCG and going back to their village home. So I had to target one antigen that nationally that approves our national goal. We have to eliminate measles by 2023. So with both of the doses at least 95%. That's why I believe this antigen target feasible for my project.
Thank you. And you talked about national goals and you talked about national plan strategies. So I just wanted to find out, is your plan aligned to the current EPI goals and the national COVID plan in your country, that's Bangladesh?
Yes, of course. That is the plan to immunize each and every children with both doses of measles vaccine, both MR1 and MR2, at least 95% at the national level and 90% at the subnational level. So we are subnational. That's why I am taking the 90%.
All right. So now I want to talk about your peer hub experience. You just talked to us about the IDEAS engine. Can you tell me if there is one thing that changed in you, maybe in your way of perceiving immunization service delivery within the context of COVID-19? What is it that changed about you because of your participation in the peer hub?
Yes, so I read those ideas every day. I read a few. Some of them were really interesting. So it actually opens my view of trying different things. We are all talking about innovation because we are doing everything for so long, but nothing changing. In our last coverage evaluation survey, 2016, Chittagong City Corporation have a full immunization coverage under 12 months with MR first dose was 81%. We are in a stall or halted situation, 81, 80, 79%, this kind of situation. So we wanted to improve this and increase this up to at least 95%. So we had to do some innovative ways, and I think IDEAS engine has that kind of materials in it. So many innovations, many of things. I actually put some of the things I learned from the IDEAS engine in this project.
All right. So Reda, I don't know if there are any other questions on Facebook.
All right. There is a question from Umar Traore, which our guest may or may not be able to answer, depending on his experience. But he asks a relevant question because we are bringing together immunization practitioners from all over the world in the COVID-19 Scholar Peer Hub. He asks actually in French, does our guest believe that this plan for Bangladesh could be transposed to African countries that may have quite a significantly different context? And maybe another way to ask that question, in looking at considering ideas in the IDEAS engine that were submitted from all over the world, Dr. Sawer Alam, did you find that it was difficult to adapt some ideas, or that some ideas were just too different from your own context? Or did you find... Yes, so tell me about that.
Reda, I thought many of the, especially those African continents, the ideas coming up from there, I found some of them were actually very different than our country context. They had this, issue like myths, fear, and this kind of things. But in our context, actually, they actually welcome this vaccine very well. Hesitancy is very low. Just this demand reduced for COVID-19 because of the fear of COVID-19. But there is no myths, or there is no such things happening. Religious sentiment. These are the things actually not exist in Bangladesh. People really welcoming immunization services in Bangladesh. Just for COVID situation, this demand slightly reduced because of fear due to COVID-19 infection. And also some of the strategies, I thought maybe for subcontinent countries like us may not be feasible here. I like ideas from subcontinent countries like India, Pakistan, and other countries. They actually more relevant to our context.
Okay, Reda, I really thank Umar Traore for that question, because that was a question I was going to ask Dr. Sawer Alam next. But I just want to ask, is there a way you are communicating, how do you communicate on immunization that ensures that there is so little or no vaccine hesitancy in your context? Because that may be something that we will need to learn about, so that especially immunization professionals in the African continent, is there a way of communication that is different? Is there something extra that you're doing that you could share with the immunization, the global immunization community?
Yes, so Bangladesh has been running this expanded program of immunization since 1979. And as my knowledge, till 1985, this problem persisted. Only 2% was the coverage. But after that, nationwide, they promoted this immunization throughout the country by the government. Direct leadership was there. So government willing to promote this immunization service. And Bangladesh actually acknowledged in many platforms globally for this immunization activity, and rewarded greatly. So I thought this hasn't developed one day. It took time, but people had that hesitancy before. But now, after system developed for quite some time, and we had so many campaigns. We eradicated polio from Bangladesh in 2000. So it's been a great achievement, and people know about this achievement. This vaccine works, and so greatly participated in the program, and I don't see hesitancy is there.
Great.
Thank you
Charlotte
very much.
Yes, do you want to thank our guest before we go? And then I'm going to give a quick recap for members of the Peer Hub or people potentially interested in joining the next round of the COVID-19 Peer Hub. If you're immunization staff trying to keep vaccination services going, stay on for another couple of minutes. I'm going to break it down exactly when you'll be able to join the Peer Hub next. Over to you, Charlotte.
Thank you, Reda, and I really want to thank you, Dr. Mohamed Sawer Alam, for accepting this invitation and for taking our time to share your Peer Hub experience with us, and also tell us what you are doing in your context to ensure that children who are eligible for vaccines get the required doses of the antigens that are due to them, and to ensure that your immunization performances are maintained within the context of COVID-19. So I just want to celebrate you today and say thank you for being our guest in this live IDEAS Bulletin.
Thank you, Charlotte, and thank you, Reda, for inviting me.
Wonderful. Thank you both. And here we go with a quick breakdown of what is coming next for the COVID-19 Peer Hub. So you can see on screen, there's a page that's going to be updated very soon. And what I really want to take you through is the calendar for the upcoming events in the Scholar COVID-19 Peer Hub. So if you are immunization staff trying to figure out how to adapt to the reality of the pandemic, how to keep vaccination going, we will be honoring colleagues who have worked for 6 weeks in the Peer Hub, developing, contributing to the IDEAS engine, and then developing action planning, peer reviewing the action plans of others, and we'll be honoring you during a commencement ceremony that will take place on the 24th of September and will be broadcast on our Facebook page, Digital Scholar. Second, if you are a current participant of the Peer Hub, we'll be asking you to complete a second Peer Hub Pulse report that is required to qualify for the next stage of the Peer Hub. Next, in many countries, an impressive number of countries, we've had people who have been creating country teams. In some countries, country teams are already established. So these are alumni who have worked in this program, who have been working in the COVID-19 Peer Hub. And on the 18th of September, we'll be recognizing formally these national teams that are really part of the EPI system, a network of people who are committed and dedicated to building their capacity, helping to make a difference, contributing to make a difference. Next, if you are here, you have just listened to an edition of the IDEAS Bulletin on Facebook. So we're running this. We ran 3 this week in French and in English. We'll be picking up within a few days, actually on the 22nd of September, very soon. In the meantime, you can enjoy the recordings of the previous editions. Starting on the 21st of September, we'll be kicking off what we're calling the Impact Accelerator Launchpad. So it'll be the second time that we run a launchpad, but of course the first time that we're doing it in the context of a pandemic with participants of the COVID-19 Scholar Peer Hub, but also we'll be inviting all of the Scholar alumni from other programs and courses to join together to really focus on taking coursework, which is more than coursework, action planning, and turning it into concrete actions. If you were part of Teach to Reach or would like to be, we'll be holding 2 conferences. The first pilot will be held 12th to 14th of October, and then the annual conference to round out the year for the Teach to Reach program will be kicking off on the 8th of December. And then last but not least is in early November. If you are in any way affected by or concerned by vaccine hesitancy, this question of demand, acceptance of vaccine, rumors, fear-mongering, conspiracy theories that are currently propagating around vaccines that are potentially doing harm to public health and harm to individuals, children, and adults and families, we will be joining together and calling for immunization staff, both those who are currently in the Peer Hub as well as those who are not yet, to join us to work together on tackling this threat to the work of immunization. So that is it for what we'll be doing in the coming weeks. I want to end with a little bit of energy and thank you for having joined this daily bulletin, this live IDEAS bulletin. We hope you're finding these voices from the field, working at all levels of the health system, to be useful to informing your thinking and really also gaining confidence that every day, by adapting, by thinking, by doing, you are helping to make a difference in the face of this pandemic and towards your country's immunization goals. We have some final messages I'd like to share. Wishing you well and see you soon.